Hi everyone, a very good morning. I am Dr. Shravan from Basavatarkam Indo-American Cancer Hospital. I'll be speaking on diabetes. We always hear that some of our relatives have diabetes, or we commonly call it as sugar. So, this day, let us know about diabetes in detail. So, what is diabetes? It's to be simple, it's nothing but uncontrolled blood sugar levels. So if you look at the central picture, it's a normal level of blood sugar. The red cells which we see are red blood cells and the blue particles which we see are sugars. So imagine a situation where there's less sugar in the blood, it's called low blood sugar or hypoglycemia. When there is more sugar in the blood, it's called as hyperglycemia or high blood sugar, which can be seen in the third picture. So let us look at the physiology of sugar control. So there is always some sugar in the blood. If we exercise, that sugar will be utilized by the body organs and the sugar will be less. So to compensate that, in order to produce more sugar, pancreas is an organ in the body which secretes a hormone called glucagon. This glucagon will act on the glycogen in the liver to create new glucose, and further it will increase the blood sugars in the body. Similarly, when we eat, the blood sugar in our body increases and stimulates the pancreas, which again leads to secretion of insulin, which causes the glucose in the blood to be shifted into the cells. So, both glucagon and insulin regulate the sugar levels in the blood. Depending on the activity, whether we are exercising, it will increase the blood sugar. When we are eating, it will decrease the blood sugar. So now that we understood about sugar control, let us see what causes diabetes. So as we saw, a healthy pancreas secretes insulin which acts on the body cells regulating glucose levels. But in some patients or some people, pancreas cannot secrete insulin. In such conditions, it is called type 1 diabetes. In some other patients, even though pancreas can secrete the hormone insulin, it doesn't act on the cell. That is called as type 2 diabetes. The type 2 diabetes is the most common. Almost 90% of the diabetes which we encounter in our day-to-day life is type 2 diabetes. Type 1 diabetes is usually seen in children. So let us look at what is the burden of diabetes in our country. According to World Health Organization, an estimated 8.7% of the population has diabetes in our country. So this causes a significant morbidity in India. Almost 90 billion rupees are spent annually to control diabetes in our country. And it is growing at an exponential rate. Almost more than 100% growth is happening in 2 decades. So let us look at the clinical features. How can we know a person or a child has diabetes? If we can see some of these features in them, we can suspect they might have diabetes, and accordingly they can get tested. So extreme thirst, even after drinking water repeatedly, the person or the child will feel thirst, extreme thirst, and frequent urination. Relative to all other colleagues, there will be frequent urination. Also weight loss and unexplained weight loss and unexplained stomach pain. And easy fatigability. Even after a healthy meal, all of a sudden they will feel fatigue in the class or in their day-to-day work. And also sweat, shaky and clammy pale face will happen due to hypoglycemia. When there is reduced sugar in our blood, all of a sudden they will be sweaty, shaky, they will become pale and unresponsive. So is uncontrolled sugar a problem to our body? Yes. When sugars are uncontrolled, when the sugars are very high, they can lead to brain stroke, kidney failure, nerve damage, loss of vision, heart diseases, and most commonly encountered food problems. So the sugars have to be controlled to have a healthy life. So how can we control this? We usually use 2 options. One is oral medications, where we take tablets on a daily basis. If sugars are not getting controlled on oral medications, we go ahead and use insulin injections. So can we prevent diabetes? Yes, in most of the cases we can prevent diabetes, but it has to be started at an early age. So the most important things which we can try and do to prevent diabetes are having a balanced healthy diet and doing yoga and exercise. So let us look at the healthy diet part. So whatever food we consume, either be it Coca-Cola, be it sugar syrup, Horlicks, anything, there is a glycemic index attached to it, meaning suppose there are two friends and one of them consumes a Snickers bar, chocolate bar, the other just eats a banana. So both of those things, both the Snickers bar and the banana will not have the same effect on their blood sugar levels. So depending on that, foods are rated based on their glycemic index. So glycemic index is nothing but it just gives an idea, rough idea, how much the blood sugar increases after consuming the diet. So based on the glycemic index, the food materials are divided into the subcategories. As we can see, the things on the left, which we mostly like pizza, chocolate bar, popcorn and soda, have high glycemic index and they are bad for the health. But vegetables, fruits and yogurt, curd, which we tend to consume less, are actually good for health and have a low glycemic index. So the other part is to have a healthy balanced diet as we previously discussed. This diet should include green leafy vegetables, fresh vegetables and fruits, whole nuts and also adequate amount of high fiber to prevent absorption of unnecessary fat and cholesterol. The things which we see in this picture, be it burger, ketchup, french fries, soda, all these are made of refined foods and have very high glycemic index. So these have to be avoided at any cost. And the second most important thing which we will discuss today is about yoga and exercise. So for adults, they are prescribed at least 30 minutes of physical activity 5 days a week. This doesn't apply to children. Children can be more active than this. They should actively participate in sports and reduce the body fat and keep the weight in control. So some of you might think, so diabetes is a problem of adults, why should I be worried at this age? But we should understand one thing, whatever habits we develop now will stay forever and they are difficult to change later at a point of time in our life when the problems arise. So we should make sure that we have a healthy diet and do regular exercise or yoga right from this age so that it becomes a habit once you reach adulthood. Thank you all